hello. I haven't done this in a long time, so welcome. Let me know where you are uh, in the chat so that I know that you're here with me and I'm here with you and everything is all good. Like I said, I haven't done this in a long time, so trying to see what's happening in the world of being live on YouTube. I've done lives on Facebook, but haven't done lives on YouTube in a long time. So let me go ahead and get started with the information that I wanted to provide for you. So welcome, welcome. Today I wanted to talk about something that seems to be prevalent in the news, but has some implication for the health information professional community. Can you code for COVID-19? And I'm sure you've heard all about the 2019 novel coronavirus or COVID-19, and it is spreading across the world. And I don't think that we've gone a day within the last several weeks or months hearing any information about the coronavirus. And so today I will introduce you to the recent coding guidance that has been released. Stay tuned to the end, so stay with me if you can, and I will share with you a bit of information you will need to know if you are sitting for a CPC exam. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. Now, as a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've helped hundreds of students become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Subscribe to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. Now, I don't know why I want to say ID. It's COVID-19 caused an outbreak of respiratory illness. Confirmed COVID-19 infections can cause a range of illness from little to no symptoms to those affected being severely ill or even dying. Symptoms can include fever, cough, and shortness of breath. So they're all kind of respiratory related at this time. At the end of February, a couple days ago, one day ago, a couple weeks ago, the Center for Disease Control, or the CDC, developed coding guidance that has been approved by the cooperating parties who are responsible for ICD-10-CM, the National Center for Health Statistics, the American Health Information Management Association, the American Medical Association, and the Centers for Medicare and Medicaid Services. So let's look at the guidance specific to pneumonia, bronchitis, ARDS, exposure to COVID-19, and signs and symptoms. For a pneumonia case confirmed as due to the 2019 novel coronavirus or COVID-19, you would assign codes J12.89, other viral pneumonia, and B97.29, other coronavirus, as the cause of diseases classified elsewhere. For a patient with acute bronchitis confirmed as due to COVID-19, you would assign codes J20.8, acute bronchitis due to other specified organisms, and you would also code B97.29, other coronavirus, as the cause of diseases classified elsewhere. Bronchitis that is not otherwise specified due to the COVID-19 should be coded using code J40, which is bronchitis not specified as acute or chronic, along with code B97.29, other coronavirus, as the cause of diseases classified elsewhere. If the COVID-19 is documented as being associated with a lower respiratory infection, not otherwise specified, or an acute respiratory infection not otherwise specified, this should be assigned with code J22, unspecified, acute lower respiratory infection with code B97.29, other coronavirus, as the cause of diseases classified elsewhere. If the COVID-19 is documented as being associated with a respiratory infection not otherwise specified, it would be appropriate to assign code J98.8, other specified respiratory disorders, with code B97.29, other coronavirus, as the cause of diseases classified elsewhere. Acute respiratory distress syndrome, or ARDS, may develop in with the COVID-19. And according to the interim clinical guidance for management of patients with confirmed 2019 novel coronavirus or COVID-19 infection, and I'll place a link to this new guidance in the description box. Cases with ARDS due to COVID-19 should be assigned codes J80, acute respiratory syndrome, and B97.29, other coronavirus, as the cause of diseases classified elsewhere. For cases where there is a concern about a possible exposure to COVID-19, but this is ruled out or after an evaluation, then it would be appropriate to assign the code Z03.818, encounter for observation for suspected exposure to other biological agents ruled out. For cases where there is an actual exposure to someone who is confirmed to have COVID-19, it would be appropriate to assign code Z20.828, contact with and suspected exposure to other viral communicable diseases. For patients presenting with any signs and symptoms such as fever, and where a definitive diagnosis has not been established, assign the appropriate codes for each of the presenting signs and symptoms, such as R05 for cough, R06.02, or 02, I'm sorry. I always say 0, not O. So R06.02, shortness of breath, or R50.9, fever, unspecified. Now, they had a note in the guidance that states diagnosis code B34.2, coronavirus infection, unspecified. I'll say that again. B34.2, coronavirus infection, unspecified, would in generally not be appropriate for the COVID-19 because the cases have universally been respiratory in nature. So the site would not be unspecified. You have a site. It's the respiratory area of the body. So you would not use B34.2. If the provider documents suspected, possible, probable COVID-19, do not assign code B97.29. You would assign a code explaining the reason for the encounter. So if they're presenting with a fever, which again is a sign and symptom, then you would code the fever, or you would code the Z20.828, which is contact with and suspected exposure to other viral communicable diseases. So you have been introduced to the new coding guidance for COVID-19. The ICD-10-CM official guidelines for coding and reporting that were effective October 1, 2019 will be updated. So you'll see all kinds of notifications related to that. So be aware and on notice. So for the CPC exam tip, when there are updates and addendums to the official coding guidance, you are allowed to have a copy of this information during your exam. So they will allow you to have that additional copy of any new guidance, addendums, etc. as you sit for your certification exam. If you want information and additional details, check out the AAPC website at aapc.com. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information on these tips and others on how to become a certified marketable medical coder, then check out the information I have below in the description box. There is a plethora of information there that will assist you and help you. If you have found this information helpful, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so that you are informed every week when I upload new content. I upload our Motivating Monday messages on Monday, and then I upload something related to coding, compliance, or healthcare or the business of healthcare in general on Thursdays. And I guess since I'm playing around with this live stream, I may try to incorporate something live maybe once or twice a month. So as I check your comments and check your questions, then I can provide you with the information. So again, give me the information that I can help you. Help me help you. So you know that I love hearing from you, and particularly those of you who are sitting for your certification exam or planning to sit for your certification exam. As you may or may not know, we are in the process of presenting information in a series on miscoding concepts. So if you've sat for that exam and you were unsuccessful, and there are certain areas of the examination that you are still unclear about, send me an email or shoot me a comment and let me know, and we would put together a video, because the questions you have may be questions that others have, and so we can put together a video and add that to our series. So let's stay connected and connect others. Like I said, there are probably others who need this information, so feel free to share. Sharing is caring. So remember to be safe, be kind, and don't wish for it, work for it. Until next time, which will probably be tomorrow, take care, and thanks so much for watching, and enjoy the rest of your day. It's a beautiful day.